Aiims, Bilaspur. We will be talking about identification and impact of hereditary risk factors for cardiovascular diseases.
Namaste to all from India. I am Dr. Nidhi Puri, Additional Professor and Head of the Department of Anatomy at All India Institute of Medical Sciences, Bilaspur, which is in the Himalayan state of Himachal Pradesh of India. My topic of discussion today is identification of and impact of hereditary risk factors for cardiovascular diseases. Cardiovascular diseases are the leading cause of morbidity and mortality globally, and it is more so in developing countries. So it is important for healthcare system to identify population at risk. The risk factors recognized so far are on the basis of surveys which have been done in 20th century, and they are mostly related to lifestyle. But recently, in addition to lifestyle, the cardiovascular risk can also be determined by genetic factors which are hereditary. Various tools to measure the hereditary risk of cardiovascular diseases are depending upon family history or various anthropometric indices, then various blood levels like of LDL, C-Reactive Protein, adiponectin. Then there are certain genetic risk markers also. Family history is a traditional tool to assess the risk, and it has been quite good to assess the risk for so far. And the CVD risk, future CVD risk depends upon the number and age of the affected first degree relatives, that the risk may vary from 40% to 75%. We conducted a survey in young population of two endogamous groups in northwest region of India. Family history of coronary artery disease, stroke, diabetes mellitus, and hypertension was noted. It was found that there was a prevalence of 74.5% in the younger age group, and thus showing a higher risk of developing cardiovascular diseases in the younger population of the said region. Anthropometric indices are easier and non-invasive methods to depict various parameters or various associations. And those depicting obesity and body fat distribution have shown an excellent correlation with cardiovascular diseases. However, digit ratio has shown a strong correlation with coronary artery disease, especially in men. In the digit ratio, index finger and the ring finger ratio, that is 2D and 4D ratio, is most studied ratio, and a high 2D/4D ratio is determinant of fetal exposure to testosterone, especially in females. And it is also correlated with many non-communicable diseases, including coronary artery disease, and it is associated with arterial sclerosis and plaque formation in right coronary artery. However, no literature is available on correlation with the coronary artery disease in women. Hence, the study was designed in the female subjects to establish any association between coronary artery disease and 2D and 4D ratio among women, and its correlation with anthropometric indices which are reflecting the lifestyle. The study was conducted on 200 female subjects divided into two groups. One group was of control who had no known history of coronary artery disease, and the second group included patients which were diagnosed with cases of coronary artery disease. Any subjects with any anomalies or surgeries of the hand were excluded from the study, and prior written consent was taken from the subjects to conduct the study. Then weight, height, waist circumference, hip circumference, index finger and ring finger lengths were measured so as to calculate body mass index, waist height ratio, and second and fourth digit ratio. All the parameters except for left 2D and 4D ratio were significantly higher in the patient group. So any value equal to or more than the mean value of the 2D/4D ratio in the patient group was taken as higher value for this case, and this has been supported by the study in literature which has reported that any value more than 0.985 on the right to the 40 ratio has correlated well with the atherosclerotic plaque in right coronary artery. Effect size, which calculates the magnitude of association between two variables, it was found to be medium for right to the 40 ratio. Apart from positive correlations, there was a strong association between the obesity and right digit ratio, thus showing that both the parameters together can be better predictors of the coronary artery disease. As per odds ratio, the risk of developing coronary artery disease was 1.83 times more with the high right to the 40 ratio as compared to the other anthropometric parameters where this odds ratio was much higher. Then prevalence of high digit ratio on the left side was seen. It was more prevalent in the patients in absence of lifestyle-related risk factors, like in normal cases of BMI and normal cases of waist circumference. Therefore, we observe that higher 2b/40 ratio is a non-modifiable marker which can be a predictor of coronary artery disease among women. High ratio on the right-hand side can be a better predictor of coronary artery disease in presence of lifestyle-related risk factors, while on the left-hand side can predict risk of coronary artery disease in absence of lifestyle-related risk factors. Then measuring the blood level. Blood levels, LDL cholesterol is an important marker. This is also used to detect familial hyperlipidemias or hypercholesterolemias, which is an inherited mutation which is seen in the genes which are related to regulation and removal of cholesterol from the blood. So, therefore, high LDL levels predispose the person to atherosclerosis and cardiovascular diseases. C-Reactive Protein, which is synthesized in the liver, is normally a marker of inflammatory phase in the body. But elevated levels of C-Reactive Protein without any inflammatory process has been found to be associated with acute coronary syndrome, myocardial infarction, and it also predicts about the prognosis in a case of coronary artery disease. However, the effect of coronary artery disease risk of CRP genotype is not associated with the levels of CRP, so it is not considered as a marker of hereditary risk in cardiovascular diseases. Adiponectin is an adipocyte-derived secretory protein in the human visceral fat. It is negatively correlated with the percentage of human visceral fat, and it is an atheroprotective and inversely related to the coronary artery disease. So it is a useful marker biomarker for coronary artery disease, the lower values of it, and it is also a predictor of adverse cardiovascular event in patients of coronary artery disease. Another non-invasive method to evaluate risk of cardiovascular disease is the genetic markers. These markers have gained importance in the last 1 decade. Genome-wide association studies have been conducted worldwide to identify various loci which are associated with the various cardiovascular diseases, and these loci are grouped for single nucleotide polymorphism, and it was surprising that only 25 to 30% of loci were spotted in the proximity of genes which have some role in LDL or triglyceride metabolism and vascular tone or platelet aggregation. That means rest of the about 70 to 75% of the loci were unrelated to the known risk of cardiovascular diseases. Many studies have translated this genetic risk burden into a single value, which is called as genetic risk score or polygenic risk score or PRS. The patients could be categorized according to the PRS into low risk, intermediate or average risk or high risk depending upon the percentile. Then the PRS can be easily calculated with the softwares which are available in the market. Calculating PRS and determining the risk of developing cardiovascular diseases has become easier. This is an example where a genotype has been found and which has determined the risk of developing coronary artery disease or risk of developing myocardial infarction. Therefore, it is concluded that family history can predict risk of coronary artery disease in 40 to 75% of cases, and the prevalence of family history in young population in northwest region was found to be 74.25, which was even higher in one particular community, thus showing that the younger population is at a higher risk. Then 2D/4D ratio, which is a non-modifiable factor, has shown an association with coronary artery disease among women. Low density LDL cholesterol levels in familial hyperlipidemias is associated with mutation of gene regulating and removing the cholesterol from blood. It also predisposes person to atherosclerosis and cardiovascular diseases. Genome-wide association studies have identified a large number of common genetic variants associated with cardiovascular diseases. Assessing the polygenic risk by summing up the effect of all the risk variants leads to polygenic risk score, which can predict the incidence and recurrence of cardiovascular diseases on top of traditional risk factors. Thank you.